Hi, I'm Dr. Carol Brotherton, author of the Clinical Gastroenterology and Hepatology paper entitled Avoidance of Fiber is Associated with Greater Risk of Crohn's Disease Flare in a 6-Month Period. We conducted this study while I was at George Mason University in Fairfax, Virginia, and I was teamed up with researchers at the University of North Carolina, Chapel Hill. And the idea for this current study came from one of my previous studies that looked at the effects of a high-fiber diet instruction compared to the effects of a low-fiber diet instruction in a small sample of individuals with Crohn's disease. And in that earlier study, there were significant differences in the outcomes between those two groups. In fact, in the high-fiber group, all of the Crohn's disease symptoms that were measured, abdominal pain, liquid stools, poor general well-being, all of those symptoms resolved for all of the participants in the high-fiber group, but not in the low-fiber group. And there's good reason why researchers around the world are testing therapeutic effects of fiber in Crohn's disease and ulcerative colitis, because fiber is the part of our food that's not digested by human enzymes, so it reaches the distal digestive system and is available for fermentation by beneficial bacteria. So the fiber that we eat becomes the food source for the microbes that we want in the gut, and it's thought that fiber has a favorable effect on microbial balance because of that. And beyond that, as the microbes ferment the fiber, short-chain fatty acids are produced, and short-chain fatty acids have a favorable effect on gut inflammation, which is the problem in Crohn's disease and ulcerative colitis. So small studies have found some favorable results, and we wanted to look on a large scale to see whether consumption of fiber is associated with risk of flare in Crohn's disease and ulcerative colitis. We analyzed data from the Crohn's and Colitis Foundation of America, or CCFA Partners database. And Partners is a longitudinal internet-based cohort of more than 14,000 participants with Crohn's disease, ulcerative colitis, or indeterminate colitis. For our analyses, we included 1,619 participants who had completed the 26-item diet survey and had completed a 6-month follow-up survey, and who were in remission at baseline. And we defined remission as less than 150 on the short Crohn's disease activity index, or less than or equal to 2 on the simple colitis activity index. We defined flare at 6 months as those participants whose activity index exceeded the cutoff for remission at 6 months, and or if they needed a related surgery or hospitalization during the 6-month follow-up. We looked at quartiles and deciles of fiber intake, and we looked at quartiles of whole grain intake. We also looked at participants based on whether or not they said they avoid fiber. That participants in the database who had longer duration of disease, or they had needed surgeries or hospitalizations related to the disease, they ate less fiber. And we also found that risks of flare differed based on disease type, Crohn's disease or ulcerative colitis. In Crohn's disease, we found that participants in the highest quartile of fiber intake were 40% less likely to flare than those in the lowest quartile. And that result held when we adjusted for age, gender, duration of disease, history of surgeries and hospitalizations, body weight. And when we looked at deciles, the results were even more striking, because those in the highest decile were 60% less likely to flare than those in the lowest decile. And when we looked at whole grains, the results were similar. And when we compared participants who did not say they avoided fiber, when we compared them to the ones who did avoid fiber, the ones who did not avoid fiber were 40% less likely to flare. In ulcerative colitis, we didn't find association between the intake of fiber and the risk of flare. We do not know why participants in the Partners database either chose to avoid fiber or to consume fiber. We do know that our findings in Crohn's disease corroborate those of Heaton, Thornton, and Emmett in the 1970s. They compared 32 Crohn's disease patients who were treated with a high-fiber diet compared to matched controls, and they found significantly fewer related surgeries and hospitalizations in the high-fiber treated group. This group also reported that in all of their combined 150 patient years of recommending a high-fiber diet for Crohn's disease, no patient developed an obstruction while on the high-fiber diet, even though many of the same patients had a history of strictures prior to starting the high-fiber diet. In conclusion, the results of our current study suggest that there is a need to explore why participants with Crohn's disease avoid fiber, and also to reevaluate low fiber recommendations that are often given to individuals with Crohn's disease.